Hello, this is Dr. Gay from First Second MRI, and this is a 21-year-old female with a recent injury, and she has a couple quick findings here. This is just a bread and butter basic example of an anterior talofibular ligament tear, the typical thing you'll see with a lateral ankle sprain. They have lots of edema along the lateral ankle here. All this bright stuff is subcutaneous edema. Back here is Kager's fat pad. It goes into a Kager's fat pad. The Achilles tendon looks normal here. Now we're going to go down. Here's the fibula, tibia. We're going down and we're getting into the joint right here. And at the level of the joint or above, we see the anterior tibiofibular ligament. Now we're going to go below that, and we're going to look for the anterior talofibular ligament. Now we're into the talus, fibula, so we're looking for the anterior. Here's anterior, and again, talofibular ligament. And it should come right across here, from here to here, or right where it's square, starting about there. You'll see it come obliquely. But instead we see this balled up anterior talofibular ligament. There's fluid undermining it here, and there's lots of edema around the lateral side. So here's a really basic, easy example of an anterior talofibular ligament rupture. Usually they're a lot harder than this because they're not balled up. They're usually just thickened, or it's hard to see. This is a clean-cut case. This is the posterior talofibular ligament here. It's almost always intact, and it's broad. And this is the one that's torn typically when there's a lateral ankle sprain. So this is just one part of it. Now the other thing is the posterior tibial tendon had an injury as well. It looks like it was torn from the navicular attachment. So this is the posterior tibial. We call it Tom, Dick, and Harry. So posterior tibial, flexor digitorum, flexor hallucis. As we come down, 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 we'll see the posterior tibial tendon here. They all look nice and dark and uniform, homogeneous. As we approach the navicular bone here, we're going to see it look abnormal. So there it is, looks foggy. Right at the attachment it can fan out and look broad and bright, but this is just too bright, too thick, and the increased signal is starting too far away from the navicular attachment. And then here's at the attachment, we just don't see it. So this is a torn posterior tibial tendon. If we look on the sagittal images, we can see this as well to confirm, because it can be difficult sometimes. Here's the medial side, and this is the image that shows it. So right here we see the navicular bone, we see the posterior tibial tendon, and normally it'll angle more towards the navicular. It looks like this angle is a little bit more posterior than we'd expect. Again, we just never see it touch. There's a little separation here. So partially torn, partially stripped from the navicular attachment posterior tibial tendon. And that's it, a couple basic findings, and have a great day.